நல்ல ஒரு ஹாஸ்பிட்டல் எதுன்னா மைனிங் ஹாஸ்பிட்டல். நல்ல சிவில் ஹாஸ்பிட்டல் இவ்வளோ பெருசு, நல்ல டாக்டர்ஸ் இல்லை. பெரிய ஹாஸ்பிட்டல் கேட்டாங்க, சிவில் ஹாஸ்பிட்டல் என்ன இருக்கு? ஒன்றும் இல்லை. நேராக கோலாறு போகணும், இல்லாட்டி கொப்பம் போகணும், வழியிலே இறந்துடுறாங்க. பெரிய பெரிய டாக்டருங்க இருந்த இடம் இந்த மாதிரி கேஜிஎஃப் நெக்லெக்ட் பண்ணி விட்டுக்கிறாங்க. ஒரு நல்ல ஹாஸ்பிட்டல் இல்லை, ஒரு கார்டியாலஜிஸ்ட் இல்லை. ஹார்ட் அட்டாக்குன்னா நம்ம கேஜிஎஃப் காரங்க நினைக்கிறோம் வழியிலே இறந்துருவோம். இது பெரிய ஒரு அபசகுணம், சாபம், சர்வநாச விநாசம் மாதிரி நம்ம கேஜிஎஃப்க்கு. இவங்க பண்ற சர்வீஸ் பார்க்கும்போது சங்கடமா தெரியுது நமக்கு. கோலாறு இல்லாட்டி கொப்பம்.
Vanakkam, Namaskaram. Good evening to one and all gathered here. On behalf of MOIDU Medicals and MOIDU Polyclinic, I welcome you all. As we all gathered here for Heart Awareness Program regarding to heart attack, on behalf of Haji Muhammad Maidu and Sons, we welcome you all. Respected Dr. B.RAJENDRA KUMAR, MBBS, MD, physician and cardiologist, I welcome you, sir. Respected Dr. DR.ARIVAZHAGAN, sir, MBBS, MS, MCH, cardiovascular thoracic surgeon, I welcome you, sir. Respected Dr. Saradha, ma'am, MBBS, I welcome you, ma'am. Respected Dr. Ingersal, MBBS, I welcome you, sir. And media presence and public on behalf of KAMAL MUNISWAMY, I welcome you all.
And we were thinking that it is a male's disease. Female were less. It has turned the coin now. Even females are getting heart attack. During menstrual period, they say that the heart attack is very less. Nowadays, we are seeing very, very young females also getting heart attack. And smallest child in the world who had heart attack is just a born child. That could be because of an abnormal blood supply to the heart itself. So that causes sudden stoppage of blood to the muscles of the heart and causes heart attack. For all practical purposes, it is heart attack. So that doesn't mean that the child is stressed out, obese or anything. So I'm just giving this as an example that it can happen because of all the causes enumerated by Dr. Arivagan. In addition, there are so many other causes also. So regular habits in our lifetime can prevent this. God has given us ample examples to see and then follow it. First example is the most constant thing on earth is sun. The same time it rises, same time it ends, same light it gives to everyone without any differentiation. So it does its work and it goes to the other side to work. So this pattern has to be followed. So same time you get up, same time you do, same service you give to everyone, whoever possible or are in need of any help, you have to extend your arms and help them out. Second thing is, in regularity, you have to be punctual in your food. The same time you have to eat, same type of food you have to eat, same quantity of food you have to eat. And every day fresh food. It should contain lot of natural food rather than altered food. Altered food is the main cause for our abnormality in our system. Now I stand here before you. You can easily identify me as Dr. Rajendra Kumar. Suppose I come with a fur cap and a dark goggles and a mush and a beard and coat, overcoat, everything. It is so difficult for you to identify me. Likewise, you get gobi from your house. Your wife, instead of preparing ordinary gobi, because of the pressure from children, she makes gobi Manchurian. It is thawed, it is burnt, it is fried, and all sorts of injuries it takes place, and then it is placed before you. That is an altered state of protein, carbohydrate, and fat. Totally altered. It is not natural. So once it goes inside, the VIP status of the protein, carbohydrate, and fat is gone because it is altered. Our system recognizes natural food. So this altered food goes waste into the system. So half of the food what you eat goes out fast. That's the reason you would have experienced also after going to a hotel. Next day you have some 2 to 3 extra motions rather than normal motion. That is called a mechanical diarrhea only because of this. And it is a temporary one. It does not require any treatment or anything. So altered food to be avoided as much as possible. Fast food to be avoided. It is always half cooked. So boiled one earlier method cooking is the best. Slow, steady, and thorough cooking is the best way to have our food regularly. Fruits, yes, you have to take fruits every day. But the present day advice is with whatever food you have, don't fill your stomach full. Don't be on empty stomach. This is the dictum, present day dictum. And with every food, with breakfast, lunch, and dinner, you have to have 4 varieties of dark colored vegetables and 4 pieces each. So 16 pieces of long cut. It should be long cut. It cannot be horizontally cut because you are cutting the fiber. So we call it as line of growth. So line of growth means from where it has started till the end, you cut the vegetable and keep it. And you add lemon to that and eat. Now, why this has to be done? You eat a combination of lot of things with lot of sugar and the other items, oil. Now, these 4 into 4 pieces has got enough fiber to control the blood sugar raise. After food, whether he is a normal person, he is an abnormal, like diabetic person, the blood sugar tends to go up. These fibrous food checks the surge of the blood sugar going up and causes postprandial blood sugar, we call. After food, what the blood sugar goes up and how long it goes up is the cause for heart problem. So eat less, eat frequently. Small quantity food frequently. Don't be on empty stomach. All the system will be charged. Don't be on full stomach. All the system will be slowed down. So these are the few tips regarding regularity. The most important thing is whatever you eat has to be spent. So you have to do exercise. Exercise means going to the gym, lifting weight. That is not the uh, purpose, what the exercise means. It is only the walking. Walking, now, earlier we would tell that every day you walk for 1 hour, 5 days in a week. Every day you walk 45 minutes, all 7 days in a week. Every day, half an hour morning, half an hour night, all 7 days in a week. Or every hour, 3 minutes to 5 minutes of walking for all throughout the time you are awake. And now the present day advice is 750 steps every hour. You walk 750 steps from morning 6 to night 10. So you'll be crossing around 10,000 steps. 10,000 steps is the necessity for a person to have a good cardiovascular system status in our body. Now, along with that, there should be an easy circulation in the body. So air is required. Breathing exercise, slow breathing is another add-on to this. So every hour, 5 times in a minute, you have to take deep breath, taking in deep breath and then leaving out deep breath. 15 seconds, one breath has to be there. 4 breaths in a minute. Why only 4 breaths? To add on to this advantage and the explanation for this is, now you have seen dog. Dog breathes 50 times, 45 to 50 times in a minute, and it lives 10 years and it goes up. Elephant breathes 12 times in a minute, lives 100 years. Man breathes 18 times, 16 to 18 times, lives 70 to 80 years. And a tortoise breathes only 4 times in a minute, lives 400 years. It took 4 generations to record the life duration of a tortoise. A single family cannot, single person cannot guess the life of a tortoise. So that's how the life is very important, where you have regularity, you have good food, and you are nature friendly. You cannot go against nature and live normally. And regarding the treatment, the first 2 hours after heart attack is the golden period. So during that period, the best person is the person with knowledge. What has to be done immediately when there is severe chest pain, when there is palpitation, when there is giddiness, when the person cannot stand, sit. The whole family should be educated regarding this. And the drug, what is given today, is a real boon for the community of KGF, because it is a life-saving drug. Immediately, if 300 mg of clopidogrel and 300 mg of aspirin is given, either swallowed or in the crushed form, if the person is semi-conscious, you just crush it and mix it with honey and paste it on the tongue. It goes inside. So that is really life-saving. And second one is, along with that, you can take 1.5 inches of ginger, raw ginger, and then ask him to chew. You can take 4 pepper, small balls, then ask him to chew. They are really helpful in the first 2 hours. So the knowledge is very important. This has to be disseminated along with the drugs. And don't wait for the ambulance, don't wait for the doctor, don't wait for the ECG, don't wait to reach the hospital. Immediately, if it is not heart attack and you have taken tablet, nothing is going to happen. They are safe drugs which are life saving in nature. So, except an alcoholic who has taken a large amount of alcohol, and a person who has got a lot of joint pains and who has taken too many painkillers, during that time, if you give, some ulcerations can happen, superficial ulcerations can happen, and it can cause bleeding. Other than that, not everyone will get this particular side effect. So, and always follow it up with the milk or omeprazole, pantoprazole, ranitidine, any antacid you can give. So, it is a really life-saving. And today's gesture is really appreciable gesture from the MOIDU family and MUNISWAMY family for the community of KGF. It is a wonderful, wonderful gesture, and people have to understand this, and media people have to really stress on this, and then really publicity has to be given, because such drugs are to be kept in the house, in the pocket always. A person who is vulnerable vulnerable, you know now who are obese individual, diabetic individual, hypertensive individual, hypercholesteremic individual, and strong family history. Very strong family history always should carry in his purse these tablets. So wherever he gets, immediately he has to take it. With this few advice, I end my talk. Thank you very much for listening.